Good morning all. My name is Mr.Danung from Nigeria. I'm going to be presenting on the topic knowledge of auxiliary healthcare workers on injection safety and biological waste handling in Taraba State, Nigeria. By way of introduction, it is well known that healthcare providers are prone to job-related hazards in the course of their work, hazards resulting from infectious agents that are of bloodborne origin, or it could be due to hazards from toxic materials. And we know that auxiliary healthcare workers are more at risk due to lack of training, unlike other skillful healthcare workers. Some of the infectious agents that healthcare providers could acquire include HBV, HCV, HIV, among others. And infection could also result or occur from other biological waste. By way of summary, the goal of injection safety and proper biological waste handling and disposal is to prevent exposure of healthcare providers to infectious agents as mentioned earlier. Excuse me. For this study, a group of 68 lay healthcare providers constituted the group of individuals for the investigations. And these persons were a staff of General Hospital Wukari and General Hospital Zing, all located in Taraba. And the participants were made up of 30 male, which constitute about 44.1%, while female were 38, constituting 55.9%. The mean standard deviation of age was 31 plus or minus 5.0 years, and the age range was from 27 to 55 years. Knowledge on injection safety and biological waste among participants were derived from ward orderlies constituting 61.7%, lab attendants 7.4%, compound laborers 13.2%, theater attendants made up of 7.4%, while laundry workers constituted 10.3%. At the end of the study, a significant difference was observed among healthcare workers in these two health facilities, with tabulated chi-square figure of 1.56, while the calculated figure was 9.488. So what led to these studies? Knowledge on risks of acquiring infections such as HBV, HCV, HIV, etc. among healthcare workers is vital. And from records, it shows that not every healthcare provider is aware of the health implications of such infectious agents. Unlike other skilled healthcare providers like doctors, nurses, lab scientists, pharmacists, among others, lay healthcare providers are not knowledgeable like these other groups. Now, these other groups are knowledgeable because in the course of their training in their various institutions, part of their curricula include how to handle infectious agents. We all know that lay healthcare workers are not trained, and so they stand the chance of getting or acquiring infections, unlike their other skilled health workers. Lay healthcare workers like ward orderlies, compound laborers, cleaners are at more risk due to knowledge gap. And awareness on post-exposure prophylaxis and positive attitude towards post-exposure prophylaxis was also important to be assessed in this group. And this study was therefore considered to be relevant and timely. By way of background, there is general improper disposal of hospital waste in most of our facilities in Nigeria, health facilities in Nigeria. Now, if we look at the picture by the right, the one on top will indicate a hospital waste that there was no segregation carried out. We can see injection, a used needle and syringe. We can see hand gloves and other material that were of waste origin. discarded in similar container. Below that picture, we'll see also waste disposal in one of the health facilities that I deliberately would not want to mention the name. But we could also see that these waste are trailing the route where the waste were coming from. So disposal is also a challenge. Now, occasional risks of health hazard in healthcare settings can occur due to this improper waste segregation and disposal. And in developing countries, attention on prevention is mostly focused on skilled healthcare workers, as I mentioned earlier, during the course of their studies in their various institutions. They will learn on how to handle infectious health care materials and how to dispose them of. However, there is a sort of neglect to auxiliary healthcare workers, because these are people that are just hired. They are lay healthcare providers. They do not know, most of the times, they do not know their left from their right in handling this waste unless they are trained repeatedly. And these people may not be knowledgeable on the health job or hazard of the job they are being carried out, and are at high risk of exposure to infectious agents. The objective of this study was aimed at assessing the knowledge of these auxiliary healthcare workers on injection safety and biological waste from biological and disposal of biological waste. And secondly, and very importantly, was assessing the post-exposure prophylaxis seeking attitude of these auxiliary healthcare workers, as it is also documented that some of them could be exposed and have very little positive attitude of seeking post-exposure prophylaxis. 2 health secondary facilities were purposefully selected in Taraba State: General Hospital Wukari and General Hospital Zing. General Hospital Wukari is located in the southern zone of the state, and the hospital was established in 1962. It's a 250-bed space hospital, and on purpose, because the location was far away from the state capital and at a different zone entirely. While General Hospital Zing, a 100-bed space hospital established in 1988, located in the northern zone of the state, northern senatorial zone of the state, was selected. Now, methods. A descriptive cross-sectional study was conducted among auxiliary healthcare workers in General Hospital Wukari, as I mentioned, and how questionnaires were used or were generated to carry out the investigation. Questions were based on CDC Advisory Committee recommendations for health infection control practices and environmental infection control practices. These questions were generated with the aim of identifying whether this group of individuals are knowledgeable or not. And the questions were generated using SurveyMonkey, and hard copies were printed and administered. 68 individuals consented, and making up of 44.1 male and 55.9 female, that were segregated as follows. Ward orderlies contributed 42, while laboratory attendants made up of constituted 5, compound laborers were 9, theater attendants 5, and laundry workers 7. Knowledge on injection safety and biological waste handling and post-exposure prophylaxis was carried out with the questionnaires, as I already mentioned, and data were collected using a semi-structured questionnaire, as I mentioned, that the questions were based on the CDC Advisory Committee recommendations on hospital infection control and environmental infection control. At the end of the day, we analyzed the data using chi-square, and at 95% confidence limit, and results were presented in tables and charts, as can be seen. Now, by results, from the results displayed, now the table indicate respondents' demographic and service delivery points segregated into the different facilities, now, and segregated also into male and female. Now, in General Hospital Wukari, they are as outlined on the table, while in General Hospital Zing, they are as outlined on the table. The chart by the right indicates general knowledge of respondents in various service delivery points on some bloodborne pathogens like HBV, HCV, and HIV. And it seems to be very high, as we can see from the chart, that out of 42 ward orderlies that participated in the study, 33 of them claim to be knowledgeable about these bloodborne pathogens, while only 21 of them recorded to have been able to know the route of transmission. In the lab, all of them, all the 5 that took part in this survey, knew the route of transmission and are knowledgeable about the bloodborne pathogens too. Compound laborers, out of 9, 3 were aware of the route of were aware of the bloodborne pathogens like HBV and HIV, while only 1 was well understood. In the theater attendants, all of them recorded that they know about the bloodborne pathogens as mentioned, and they also know about the route of transmission. There was a difference in laundry cleaners, where out of 7 of them, 2 of them claimed to know that they are aware of HBV, HCV, and HIV. However, none seems to understand the route of transmission. Ward orderlies, compound cleaners, and laundry workers are less aware of the route of transmission, and this indicates a knowledge gap. The next chart is the use of gloves, some use of personal protective equipment like gloves and rain boots for the compound laborers. This information was obtained using the questionnaire and also observation. It was observed that out of the 42, or recorded that out of the 42 ward orderlies, 29 of them recorded or noted to have said that they use personal protective equipment occasionally, and only 11 were reported to have used it regularly. Laboratory attendants, out of 5, 3 of them use it occasionally, while 2 use it consistently. Compound laborers, out of 9, 7 use it occasionally, while only 2 use it consistently. That's personal protective equipment. The difference was in the theater attendants, where all of them, out of all the 5 that reported, all of them use it consistently, use personal protective equipment consistently. Under compound laborers, only 5 use it occasionally, while only 1 use it consistently. The next graph by the right shows us exposed ancillary healthcare workers versus those who access special prophylaxis. Now, out of the number of ward orderlies that claim to have been exposed with needle stick injury, 20 of them said were exposed with needle stick injury in the past 6 months or so, while only 8 of them access post-exposure prophylaxis. While out of lab attendants, all of them that were exposed within that 6 months had PP, post-exposure prophylaxis. Compound laborers, none access post-exposure prophylaxis out of all the 4 that were exposed to needle stick injury. Theater attendants, all of them that reported needle stick injury accessed post-exposure prophylaxis, while none accessed post-exposure prophylaxis among the laundry workers. In using chi-square to establish the difference of means, it was established that there is a significant difference among the ancillary healthcare workers with tabulated value of chi-square 1.56, while the calculated value was 9.488 at a 95% confidence interval. In conclusion, There seems to be, from findings, there is a dearth of knowledge on injection safety and biological waste handling among ancillary healthcare workers in those two health facilities, as can be seen from the results recorded above. Among those exposed, only about half had attitude of assessing post-exposure prophylaxis, which is also a big challenge. It is important that knowledge is passed onto these individuals so that for them to know the risks involved in being exposed by needle stick injury and to seek appropriately post-exposure prophylaxis. It thus prompts the need for awareness creation and capacity building on injection safety and biological waste handling standards in the two health facilities. Future step. It is being recommended that capacity building on injection safety and biological waste handling is critical and should be provided in this category of workers. Awareness creation and HPV vaccine by management. It should be made mandatory for healthcare workers that all people, all healthcare providers that are engaged in day-to-day work with biological waste should have access to HPV vaccine and complete dosage, and it should be made mandatory. Provision of detailed contacts and steps to be taken for post-exposure prophylaxis is also critical, and as some of them claim to have had needle stick injury and don't know what to do. So there's need for a proper detailed contacts and steps to be taken following post-exposure prophylaxis following needle stick injury or any exposure of that sort. There is also need for availability of utility gloves, rain boots, etc. for cleaners to avoid exposure to biological waste. As I said earlier, it was observed that even some of the compound laborers that were doing the cleaning, without the appropriate personal protective equipment, and such should be made available. And it's also recommended that similar research in other health facilities could be carried out, and this could serve as an eye-opener, because this was limited to only two health facilities, and I do know that the more the merrier. So thank you all for listening, and God bless you all.